Thank you, Yusuf. All right, it is my pleasure to begin the AI in healthcare panel. We have two amazing gentlemen to my left here, and both of them have very unique research backgrounds that bridge the worlds of AI and health. I'm going to first introduce Dr. Senan. And he has a PhD in computational neuroscience. He did research focusing on machine learning of seizure prediction. So this is an interesting space, obviously bridging the worlds of AI and healthcare. He's also the founder of Hikma Health, an organization dedicated to end-to-end service for Syrian refugees, healthcare, and again, bringing his interdisciplinary skill set to treatment of a group in need. We also have Dr. Ismail here, who did his PhD in biochem and molecular physics with a focus in his research on biotechnology, biosensors, testing protein generation for neurodegenerative diseases like Alzheimer's. He last year was recognized as a rising star in biomedical research by MIT. And he is currently a postdoctoral fellow at NYU. I'm going to, honestly, the introductions alone were a little overwhelming for me because we've got some obviously incredible talent here. I want to start the discussion by having Dr. Senan and Dr. Ismail just talk a little bit about their own personal backgrounds, why they chose their research, and what their research is about. Dr. Senan.
Thank you, Ahmed. It's a privilege and a pleasure to be here. So I want to start today by asking everyone a question, which is, to whom does the data revolution in healthcare belong? Right? It's happening all around us. Some of you might already see it. Some of you might use One Medical, might use some of these telemedicine apps. It's happening here, right? It's part of this fourth revolution in health, this fourth industrial revolution that Yusuf was mentioning. But to whom does it really belong? Does it belong to the guys in Silicon Valley? Does it belong to the folks in DC? So I have three answers. I have three folks that I've met that I can share with you that I hope the data revolution in healthcare will belong. The first is Hisham. He's a 7-year-old Syrian refugee boy living in Jordan, and he has type 1 diabetes. He nearly died from a diabetic crisis. So his parents didn't even know that he had diabetes. Neither did his doctors. He keeps coming in with constitutional symptoms, night sweats, and so on. And we got lucky in this case, right? They were able to save him in the ER, but it shouldn't have even gotten that far. So it's kids like Hisham who would really benefit from a data system that if the doctors only knew when he showed up that someone, maybe 5 years ago, diagnosed him as type 1 diabetes, they would have known that what he indeed needed was insulin. Second person who my brother Hassan and I actually met when we were in Lebanon is a lady approximately in her 70s. We'll call her Hajje, which just means like an honorific. And Hajje was like, we said, yeah, Hajje, we're trying to learn about diabetes and how refugee folks manage their healthcare. So she had type 2 diabetes and had kind of had it her whole life. And we asked her, so what do you think that means, having type 2 diabetes? You know, what's a good glucose level and what do you think might happen? And she said, oh, well, you know, I know that it's really bad if I get to between 200 and 250, I can get retinopathy, and I can get nephropathy. And I was like, oh my God, like this, she could have taught me in medical school, right? I was very impressed. So we asked her, well, Hajji, how do you know all this? And she said, well, you guys never heard of Ammo Google? That's Uncle Google. He doesn't lie. So it was amazing to see, right, that it doesn't matter where you are in the world, it doesn't matter your socioeconomic status. Indeed, just with the click of a phone, you can access that information as long as you have an internet connection. And the last person I'll share with you is a young man named Majid, who is also a refugee. He now lives in Greece. And he managed to cross across the Mediterranean Sea, arrived in Lesbos, and now he's able to share his story with the world. He's an athlete, he's training, he works with an amazing NGO called Yoga and Sport for Refugees, and he actually just won his first race last weekend. So, you know, there's a lot of folks all around the world, highly mobile folks, sometimes refugees, living in different states of health. And these are people who, we like someone was mentioning on the earlier panel, right? We like to think of, oh, they're sick, they really need our help, but it doesn't matter what state of health they are. There are folks to whom this data revolution also belongs. It doesn't just belong at Harvard and MIT, it doesn't just belong in Silicon Valley, it belongs right here with all of us and the people we meet and serve. So there's 70 million refugees all around the world today, and the way things are going, unfortunately, if you include the victims of climate disasters, which are now in effect, at least at some level, man-made, it's going to be 200 million in a few years. And we are, at Hikma Health, the organization that I founded, we are aiming to create a digital health solution that's going to work for all of these millions of displaced people. My family actually originated in Syria, and my own grandmother was displaced by the Syrian civil war. And that, to me, made it personal, but seeing all these other folks and hearing all of their stories moved me to found Hikma Health. And my research was largely on seizure prediction in epilepsy, which is a very niche use case of machine learning. That, if you have a lot of really complicated, machinery to basically record the brain signals, you can then use the software that I developed. But I got to thinking, well, why can't we just, basically anyone with a mobile phone, right? It doesn't matter now if they have an iPhone, $1,000, I don't even know how much now, an Android that costs $100, right? If we build the software and meet them where they are, right? Build the software that meets their needs, and if a doctor's only spending 3 minutes with a patient, which is indeed what we see in Jordan and Lebanon, then we can't build the same kind of EHR systems, the electronic health record systems that your doctors might use, right? Where they're sitting there for 20 minutes barely looking at you. Right, we need to come up with a solution that captures the essential information, will help them triage their patients, will help them know the appropriate diagnoses for chronic care, and will interface with the hardware, the diagnostic and treatment modalities that they actually have available there. So that was how Hikma Health was born. And we are basically partnering with clinical NGOs around the world to bring our health data software that we've built to populations that are highly mobile, low resource, and very much in need of chronic care management. And you might think of those as being, the developing world, but literally in this country, right, we have a diabetes crisis. And in Native Americans, it's 16% of the population, right? And you've got folks at the border who have no health care whatsoever. So literally there's not a place on earth that this digital health revolution wouldn't make a huge difference. But what's really exciting to me is that we can leapfrog here, right? Even there's folks where their data is being collected on paper and lost literally to the wind. And there, we have an opportunity to institute a digital health system that includes predictive analytics. So we can tell them, not only does Hisham have diabetes, this is what his glucose level is today, and this is where we predict it goes. And if you give him the right glipizide and glyburide and whatnots, he'll get into the safe zone. That's what's really exciting to me, that we might actually be able to institute the very first application of machine learning in healthcare that actually helps real patients on wide scale. We've actually already developed a vaccine predictor that performs at a level where you could actually use it in the field and say, these are the folks that are at risk for not actually coming in to finish their vaccine schedule. So thank you. We're really excited to democratize the revolution in digital health, and it's a pleasure to be up here with such talented folks as well.
Thank you, Dr. Senan. Dr. Ismail, you similarly have an amazing background bridging, again, tech and AI and healthcare. Could you talk to us about your research and what you're doing now?
All right, so I got interested in pathology just by taking a first-year medical classes, and I was interested in how disease develops. And so I started out a year later in the PhD program, kind of left medical school and thinking more about the science part behind these pathologies. And one thing that was clear is that if you look at it just from like the molecular level, you don't know what's going on. So if you want to develop prevention or assays to track these pathologies, you have to get down into the details. And getting into the details, you have to generate tons of data. So I'll give you an example of some of the work that I did in grad school and then what I'm doing today in this regard. So we were looking at the proteins that are involved in Alzheimer's. We're a growing population that is living longer than ever. So a lot more of the population will experience Alzheimer's, or other forms of dementia, right? So we have to figure out ways to prevent that, ways to treat it, ways so that all of us live higher quality lives as we become older. So one of the main problems with Alzheimer's is that it's a disease where you have aggregation of proteins in your brain, right? And it reaches a critical mass and there's no way going back, right? So what we wanted to look at is, what is that mechanism of how it gets there from the start to the finish? So in order to do that, we looked at these proteins in test tube, and we put on them biosensors where we can track these different movements, ensembles of these proteins, and as they aggregate and become the full form-fledged Alzheimer fibrils and tangles, right? And in doing so, we've published tons of data about this in a lot of other groups that showed that there's a diverse, ways of these proteins getting there, right? So now we have not just a bunch of data, but it's all different for different populations of people, right? So now we have to address, okay, where's the best way to start? What is the commonalities between these diverse pools of data for the same disease, right? So we looked at, prevention, so there's this thing called nucleation, the start of this protein aggregation, right?